To structure the program on health literacy into a coherent and effective educational journey, we'll organize the content into a series of logically sequenced modules, starting from foundational knowledge and progressing to more advanced and specialized topics. This sequence ensures that students build a strong base and gradually develop the skills necessary to navigate and understand complex medical literature and its implications for health policy and individual decision-making. Module 1, Introduction to Health Literacy. Objective: to establish a foundational understanding of health literacy, including its importance and impact on health outcomes. Topics covered: definition of health literacy, its components, importance and impact on individual and community health. Module 2, Foundations of Health and Medicine Literature. Objective: to introduce students to the basics of health and medical literature, focusing on types of health information and initial skills in evaluating the credibility of sources. Topics covered: types of health information, for example, articles, studies, reviews, evaluating sources, introduction to medical terminology. Module 3, Navigating Health Information. Objective: to develop skills in finding and interpreting health information, with an emphasis on using databases and understanding health news. Topics covered: using medical databases, for example, PubMed, interpreting health news, understanding study types, observational studies, clinical trials. Module 4, Critical Analysis of Medical Literature. Objective: to equip students with the skills to critically assess medical research papers and literature, focusing on methodology, statistical analysis and results interpretation. Topics covered: research methodology, basics of statistical analysis, critical appraisal of research findings. Module 5, Advanced Topics in Medical Literature. Objective: to delve into advanced topics in medical literature, including complex statistical methods, meta-analyses and systematic reviews. Topics covered: advanced statistical concepts, conducting and interpreting meta-analyses and systematic reviews. Module 6, Health Literacy in Practice. Objective: to apply health literacy skills to real-world scenarios, including risk assessment, treatment evaluation and decision-making. Topics covered: risk assessment, evaluating treatment options, decision-making frameworks. Module 7, Ethical and Social Considerations. Objective: to explore the ethical, social, and policy implications of health literacy and medical literature. Topics covered: ethics in medical research, privacy concerns, impact on public health policy. Module 8, Practical Skills in Health Literacy. Objective: to develop practical skills in using health literacy in various contexts, including patient education, public health initiatives, and personal health management. Topics covered: patient education techniques, designing public health campaigns, managing personal health information. Module 9, Research and Writing in Health Literacy. Objective: to foster skills in conducting health literacy research and writing, focusing on research design, data analysis, and scholarly writing. Topics covered: research design, data collection and analysis, writing and publishing in health literature. Capstone Project. Objective: to synthesize learning and apply comprehensive health literacy skills to a real-world project. Project examples: developing a health literacy program, conducting a small-scale research project, creating educational materials for a specific population. This curriculum is designed to be flexible, allowing for updates and adjustments as the field of health literacy evolves. Incorporating interactive and practical elements, such as case studies, simulations, and group projects, will enhance learning outcomes and prepare students for real-world challenges in health literacy and medical literature. Continuing from where we left off, let's add definitions, key terms, and examples to a couple more slides to illustrate how to enrich the course content further. Module 1, Introduction to Health Literacy, Continuation. Slide 4, Components of Health Literacy. Text, Components of Health Literacy. Bullet points. Print literacy, reading and writing health information. Numeracy, understanding numbers in health contexts. Oral literacy, speaking and listening in health contexts. Navigational literacy, navigating the healthcare system. Narration, health literacy is multifaceted, comprising print literacy, numeracy, oral literacy, and navigational literacy. Each component plays a vital role in how we access, understand, and use health information. Definitions. Print literacy, the ability to read and understand written text. Numeracy, the ability to use and understand numbers in daily life. Oral literacy, the skills in listening and speaking effectively. Navigational literacy, the ability to navigate the healthcare system, including understanding healthcare services and insurance. Key terms: print literacy, numeracy, oral literacy, navigational literacy. Example: consider how navigating insurance documents. Navigational literacy requires understanding complex terminology and making decisions based on that information. Slide 5. Historical context of health literacy. Text: evolution of health literacy. Bullet points. Early recognition in the 1970s. Shift from basic reading skills to comprehensive health management. Narration: the concept of health literacy has grown since the 1970s, shifting from a focus on basic reading skills to encompassing a comprehensive approach to managing one's health. Definitions. Health literacy, historical perspective, the evolution of the concept from basic abilities to read and understand health information to a comprehensive approach that includes managing and making informed decisions about one's health. Key terms: evolution, comprehensive health management. Example: in the 1970s, health literacy might have meant understanding a vaccination pamphlet. Today, it encompasses evaluating online health information, discussing options with a healthcare provider, and making informed decisions about treatments. Slide 6. Global health literacy. Text: health literacy around the world. Bullet points. Varied levels of health literacy across countries. Impact on global health initiatives and policies. Narration: health literacy varies globally, influencing not only individual health outcomes but also shaping the effectiveness of health policies and international health initiatives. Definitions. Global health literacy, the diverse levels of health literacy found across different countries and its impact on global health initiatives. Key terms: global health initiatives, health policies. Example: a country with high levels of health literacy may have more effective public health campaigns and better individual health outcomes, compared to countries where health literacy is not as widespread. To continue this process for the full course, focus on these steps for each slide or module component. Identify key concepts. Pinpoint the main idea or concept you want to teach in each part of the module. Define and explain. Provide clear definitions for all key terms and concepts. Where possible, use simple language to ensure accessibility. Incorporate examples. Use real-world examples to illustrate abstract concepts, making them more relatable and easier to understand. Engage with questions. Pose questions to provoke thought or discussion, encouraging students to apply what they've learned. Apply to real life. Connect concepts to students' everyday lives or current events to highlight the relevance of health literacy. Given the intricate nature of crafting verbatim, detailed course content for health literacy, let's proceed by further expanding our example with additional slides, focusing on enriching the narrative with definitions, key terms, examples, and integrating a more interactive approach to teaching. Module 1, Introduction to Health Literacy, further continuation. Slide 7, Types of Health Information. Text: navigating health information. Bullet points. Medical instructions and prescriptions. Health policies and insurance documents. Public health communications. Narration: understanding health information is pivotal. It comes in various forms, including medical instructions, insurance documents, and public health messages. Each type requires different literacy skills to interpret and use effectively. Definitions. Medical instructions, specific guidelines provided by healthcare professionals on how to take medications or follow treatment plans. Health policies, regulations and guidelines related to healthcare and insurance coverage. Public health communications, information disseminated to the public to promote health measures and awareness. Key terms: medical instructions, health policies, public health. Example: reading a prescription label requires numeracy to understand dosages and print literacy to comprehend instructions. Slide 8, Sources of health information. Text: where does health information come from? Bullet points. Healthcare providers and professionals. Online health portals and websites. Health advocacy and community organizations. Narration: reliable health information can be sourced from various places: healthcare providers, online portals, and community organizations. Knowing where to look is as important as understanding what you find. Definitions. Healthcare providers, professionals who offer therapeutic services, including doctors, nurses, and pharmacists. Online health portals, websites offering health-related information, ranging from medical research to patient education. Key terms: healthcare providers, online health portals, health advocacy. Example: consulting a healthcare provider or reputable online health portal can offer valuable insights into managing chronic conditions. Interactive discussion point. Prompt: think of a time you sought health information. Where did you go? How did you decide if the information was reliable? Activity: split the class into small groups to discuss their experiences and present their findings. Slide 9, Making health decisions. Text: using health literacy in decision making. Bullet points. Evaluating treatment options. Understanding health risks and benefits. Consent and patient rights. Narration: health literacy is instrumental in making informed health decisions. It involves evaluating treatment options, understanding risks and benefits, and navigating consent and patient rights. Definitions. Informed consent, a process ensuring patients understand the risks and benefits of treatments before agreeing to them. Key terms: treatment options, health risks, informed consent. Example: choosing between medications involves weighing the benefits against potential side effects, requiring a clear understanding of both. Slide 10, Health literacy in daily life. Text: health literacy outside the clinic. Bullet points. Preventive health behaviors. Interpreting nutrition labels and health claims. Emergency preparedness. Narration: health literacy extends beyond the healthcare setting, influencing daily choices and behaviors, from reading nutrition labels to preparing for emergencies. Definitions. Preventive health behaviors, actions taken to prevent disease and maintain health, such as vaccination or regular exercise. Key terms: nutrition labels, health claims, emergency preparedness. Example: understanding nutrition labels can guide healthier food choices, impacting long-term wellness. Interactive exercise. Prompt: select a product and interpret its nutrition label. Discuss what the information means for someone with a specific health condition, like diabetes. Activity: students work in pairs, choosing products to analyze and presenting their interpretations. Expanding on the foundational elements established in the earlier slides, we delve deeper into applying health literacy in more complex scenarios, focusing on the critical evaluation of health information and effective communication within healthcare settings. This continuation aims to further enrich the course with interactive components, fostering active learning and practical application of concepts. Module 1, Introduction to Health Literacy, further expansion. Slide 11, Critical evaluation of health information. Text: evaluating the credibility of health information. Bullet points. Assessing the source of information. Understanding research methods and statistics. Identifying bias and conflicts of interest. Narration. Not all health information is created equal. Being health literate means being able to critically evaluate the credibility of the information, considering the source, understanding the research behind it, and spotting potential biases. Definitions. Bias, a tendency to present information in a way that unfairly favors one side. Conflicts of interest, situations where personal or institutional interests could unduly influence one's judgments or actions regarding the information provided. Key terms: credibility, research methods, statistics, bias, conflicts of interest. Example: when a new medication is promoted by a company that stands to profit from its sale, it's crucial to review the research critically, looking for independent verification of the claims made. Slide 12. Health literacy and communication. Text: effective communication in healthcare. Bullet points. Asking questions and expressing concerns. Sharing accurate health history and current medications. Understanding and following medical advice. Narration: effective communication is a cornerstone of health literacy. It involves being proactive in asking questions, accurately sharing your health history, and ensuring you understand the medical advice given. Definitions. Effective communication, the exchange of information in a way that is clear, understandable, and actionable for all parties involved. Key terms: communication, health history, medical advice. Example: write down questions before your appointment to make sure you address all your concerns with your healthcare provider, ensuring you fully understand your treatment plan. Interactive discussion point. Prompt: reflect on a healthcare experience where communication played a key role. What was effective, and what could have been improved? Activity: in small groups, students share their experiences and discuss the importance of clear communication in healthcare settings. Slide 13. Navigating healthcare systems. Text: understanding the healthcare system. Bullet points. Insurance coverage and policy understanding. Rights and responsibilities as a patient. Accessing and utilizing healthcare services. Narration: navigating the healthcare system can be daunting. Health literacy helps individuals understand their insurance coverage, know their rights and responsibilities as patients, and effectively access and utilize healthcare services. Definitions. Healthcare system navigation, the ability to understand and effectively utilize various components of the healthcare system, including insurance, services, and patient rights. Key terms: insurance coverage, patient rights, healthcare services. Example: knowing how to appeal an insurance coverage decision or how to access specialist care can significantly impact your health outcomes. Slide 14. Health literacy for preventive care. Text: the role of health literacy in preventive care. Bullet points. Understanding preventive measures and screenings. Vaccination and its importance. Lifestyle choices and chronic disease prevention. Narration: health literacy is not just about managing illness, it's also about preventing it. This includes understanding which preventive measures are recommended, the importance of vaccination, and how lifestyle choices can influence health outcomes. Definitions. Preventive care, health care designed to prevent disease before it occurs, through screenings, vaccinations, and education on healthy lifestyle choices. Key terms: preventive measures, screenings, vaccination, lifestyle choices. Example: recognizing the role of a balanced diet and regular exercise in preventing chronic diseases like type 2 diabetes is a key aspect of health literacy. Interactive exercise. Prompt: choose a common preventive measure, such as mammography or colonoscopy. Research its recommended frequency and benefits, and prepare a brief presentation. Activity: Students work individually or in pairs to research a preventive measure and then share their findings with the class, highlighting the importance of being informed and proactive about preventive care. Expanding further, we'll delve into the application of health literacy in understanding public health information and making informed decisions regarding personal health care. This section aims to illustrate the practical aspects of health literacy, empowering students to apply their knowledge in evaluating health news, advocating for personal and community health, and understanding the impact of health literacy on public health outcomes. Module 1, Introduction to Health Literacy, Continued Expansion. Slide 15, Understanding Public Health Information. Text, Interpreting Public Health Messages. Bullet points. Evaluating the source and purpose of public health campaigns. Distinguishing between evidence-based recommendations and misinformation. Applying public health information to personal and community health. Narration. Public health messages play a vital role in our society, from vaccination campaigns to disease prevention guidelines. Health literacy enables us to critically evaluate these messages, separating reliable information from misinformation. Definitions. Public health information, messages and campaigns aimed at informing the public about health-related issues, often aimed at preventing disease or promoting health. Key terms: public health campaigns, evidence-based recommendations, misinformation. Example: during a flu season, understanding and acting upon reliable public health advisories can protect not only yourself but also those around you. Slide 16, Health Literacy and Health Decision-Making. Text, Informed Health Decisions. Bullet points. Using health literacy to interpret risk and benefit information. Making health decisions that align with personal values and information. The role of health literacy in patient advocacy and self-care. Narration. Health literacy empowers us to make informed decisions about our health care, interpreting risks and benefits in the context of our personal values. It also underpins our ability to advocate for our own health needs. Definitions. Informed health decisions, choices made about health care that are based on a comprehensive understanding of the available information, risks, and benefits. Key terms: risk information, personal values, patient advocacy, self-care. Example: deciding whether to undergo a particular medical procedure involves weighing the potential benefits against the risks, a process that requires solid health literacy skills. Interactive discussion point. Prompt: consider a significant health decision you or someone you know has faced. Discuss how health literacy influenced the decision-making process. Activity: students share experiences in small groups, reflecting on how information was gathered and assessed, and the impact of health literacy on the decisions made. Slide 17, Health Literacy and Chronic Disease Management. Text, Managing Chronic Conditions with Health Literacy. Bullet points. Understanding chronic disease management plans. Navigating healthcare services for long-term conditions. The impact of health literacy on managing chronic diseases effectively. Narration: for those living with chronic conditions, health literacy is a key tool in managing health over the long term, from understanding treatment plans to navigating the healthcare system. Definitions. Chronic disease management: the ongoing care and management of conditions such as diabetes, heart disease, and asthma, requiring regular monitoring and treatment adjustments. Key terms: chronic conditions, treatment plans, healthcare navigation. Example: a person with diabetes uses health literacy skills to interpret blood sugar readings, adjust their diet, and communicate effectively with their healthcare team. Slide 18, The Role of Health Literacy in Public Health Outcomes. Text, Health literacy's impact on public health. Bullet points. Connecting individual health literacy to community health outcomes. The effect of widespread health literacy on disease prevention and health promotion. Strategies for improving health literacy within communities. Narration: health literacy is not just an individual asset, it's a community resource. Higher levels of health literacy within a community can lead to better public health outcomes, from reduced disease transmission to improved overall health. Definitions. Public health outcomes, the results of various health measures and interventions on the health status of populations. Key terms: community health, disease prevention, health promotion, health literacy improvement. Example: communities with strong health literacy programs experience lower rates of infectious diseases and higher rates of health screening participation. Interactive exercise. Prompt: identify a public health issue in your community. Discuss how improving health literacy could impact this issue. Activity: students research a local public health issue, then work in groups to propose health literacy-based interventions. They present their strategies, highlighting the potential impact on the community's health. For Module 2, Foundations of Health and Medicine Literature, we'll focus on equipping students with the knowledge to navigate and critically assess health and medical literature. This module will introduce various types of health information, provide foundational skills for evaluating the credibility of sources, and introduce basic medical terminology. Let's develop the detailed content for 10 slides as requested, following the established format. Module 2, Foundations of Health and Medicine Literature. Slide 1, Introduction to Health and Medical Literature. Text: Exploring Health and Medical Literature. Narration: Welcome to Module 2, where we'll dive into the world of health and medical literature. Understanding these resources is crucial for anyone looking to navigate health information effectively. Slide 2, Types of Health Information. Text: Understanding different types of health information. Bullet points. Scientific articles, peer-reviewed research findings. Review articles, summaries of research on a specific topic. Clinical guidelines, best practice recommendations. Narration: Health information can take many forms, from scientific articles presenting new research to review articles summarizing what's already known, and clinical guidelines offering best practice recommendations. Definitions. Scientific articles, articles presenting original research findings, typically peer-reviewed. Review articles, articles summarizing the state of research on a specific topic. Clinical guidelines, documents providing recommendations based on a review of evidence for clinical care. Key terms: peer-reviewed, summaries, best practices. Example: a scientific article might introduce a new treatment for hypertension, while clinical guidelines would tell doctors how to implement this treatment based on the evidence. Slide 3, Evaluating Sources. Text: How to evaluate health information sources. Bullet points. Assess the source's credibility. Look for peer-reviewed material. Check for conflicts of interest. Narration: Not all information is created equal. Evaluating the source's credibility, whether it's peer-reviewed, and checking for conflicts of interest are key steps in assessing health information. Definitions. Credibility, the trustworthiness or reliability of a source. Peer-reviewed, the process by which an article is scrutinized by experts in the field before publication. Key terms: credibility, peer-reviewed, conflicts of interest. Example: a peer-reviewed article on cardiovascular health published in a reputable medical journal is more reliable than an unsourced blog post on the same topic. Slide 4, Introduction to Medical Terminology. Text: The language of medicine. Bullet points. Understanding basic medical terms. Decoding complex terms using roots, prefixes, and suffixes. Applying medical terminology in reading literature. Narration: Medical literature is filled with specialized language. Understanding basic medical terms and learning to decode complex ones using roots, prefixes, and suffixes can significantly aid in comprehension. Definitions. Medical terminology, the specific language used by healthcare professionals that allows for precise and efficient communication. Key terms, prefixes, suffixes, roots. Example, the term hypertension can be broken down into hyper meaning excessive or high, and tension referring to pressure, together referring to high blood pressure. Slide 5, primary versus secondary sources. Text, primary versus secondary sources in medical literature. Bullet points. Primary sources, original research articles, clinical trial reports. Secondary sources, review articles, editorials, commentary. Narration, understanding the difference between primary and secondary sources is key. Primary sources provide original research findings, while secondary sources offer summaries or commentary on those findings. Definitions. Primary sources, original research articles or reports presenting new findings. Secondary sources, publications that summarize, analyze, or comment on primary sources. Key terms, primary sources, secondary sources. Example, a clinical trial report on a new diabetes medication is a primary source, while an article reviewing several trials on the medication is a secondary source. Slide 6, finding reliable health information. Text, navigating to reliable health information. Bullet points. Using reputable medical databases and libraries. Identifying authoritative health information websites. Utilizing academic journals and professional associations. Narration, reliable health information is foundational for making informed health decisions. Knowing where to find this information, such as in reputable databases and through authoritative websites, is essential. Definitions. Medical databases, online databases containing a vast array of medical literature, including articles, research papers, and clinical trial reports. Key terms, databases, libraries, academic journals. Example, PubMed is a well-known medical database that provides access to millions of scientific articles, making it an invaluable resource for finding reliable health information. Slide 7, the peer review process. Text, understanding the peer review process. Bullet points. The role of peer review in ensuring research quality. The steps involved in the peer review process. Evaluating the impact of peer review on the credibility of information. Narration, the peer review process is a critical mechanism for ensuring the quality and reliability of scientific research. By understanding how this process works, you can better assess the credibility of the information you encounter. Definitions. Peer review, a process by which a scholarly work, such as a paper or a research proposal, is checked by a group of experts in the same field to ensure it meets the necessary standards before it is published or funded. Key terms, research quality, credibility, scholarly work. Example, when a new study on heart disease is submitted to a medical journal, it undergoes peer review where other heart disease experts evaluate its methodology, findings, and conclusions before it is published. Slide 8, critical reading of medical literature. Text, skills for critical reading of medical literature. Bullet points. Identifying the study's objective and research questions. Assessing the methodology for strengths and weaknesses. Interpreting results and understanding their implications. Narration, critical reading of medical literature involves more than just understanding the words on the page. It requires an assessment of the study's design, an evaluation of its methodology, and a thoughtful interpretation of its results. Definitions. Critical reading, the active process of understanding and evaluating the content of a text for its relevance, accuracy, and quality. Key terms, methodology, results, implications. Example, when reading a study on the effectiveness of a new cancer treatment, critically assess how the research was conducted, such as the size and selection of the study group, to understand the reliability of the findings. Slide 9, Ethical considerations in medical research. Text, ethics in medical research. Bullet points. Understanding informed consent and participant rights. Recognizing ethical issues in study design and conduct. The role of ethics committees and review boards. Narration, ethics play a critical role in medical research, ensuring that studies are conducted responsibly and with respect for participant rights. Familiarity with these ethical considerations is essential for anyone engaging with medical literature. Definitions. Informed consent, the process by which researchers inform participants about the nature of a study, its risks and benefits, and their rights, ensuring participants' voluntary agreement to partake. Key terms, ethics, participant rights, ethics committees. Example, before joining a clinical trial for a new asthma medication, participants must be fully informed about the study's purpose, potential risks, and their rights, including the right to withdraw at any time. Slide 10, The Future of Health and Medicine Literature. Text, Emerging Trends in Health and Medicine Literature. Bullet points. The impact of digital technology on medical research dissemination. Open access and its role in democratizing knowledge. Challenges and opportunities in the age of information overload. Narration, the landscape of health and medical literature is rapidly evolving, with digital technology playing a key role in how research is disseminated and accessed. Understanding these trends will help you navigate the wealth of information available. Definitions. Open access, a publishing model that allows free, immediate access to research findings, facilitating the widespread dissemination of knowledge. Key terms, digital technology, democratizing knowledge, information overload. Example, open access journals make it easier for both healthcare professionals and the general public to access the latest research findings without subscription barriers, promoting a more informed society. For Module 3, Navigating Health Information, we will focus on equipping students with the necessary skills to proficiently find and interpret various forms of health information. This includes leveraging medical databases, discerning health news, and comprehending the distinctions between different types of studies. The following slides are structured to provide a comprehensive understanding of these topics, with an emphasis on practical application and critical thinking. Module 3, Navigating Health Information. Slide 1, Introduction to Navigating Health Information. Text, Mastering Health Information Navigation. Narration, Welcome to Module 3, where we embark on the journey of navigating through the vast sea of health information. Our goal is to harness the power of medical databases and critically interpret health news, becoming informed consumers of health information. Slide 2, Using medical databases. Text, Leveraging medical databases for health information. Bullet points. Introduction to medical databases, what they are and why they matter. Guided tour of PubMed, a primary resource for accessing medical research. Tips for effective searching, keywords, filters, and advanced search features. Narration, medical databases are treasure troves of health information. Today, we'll focus on PubMed, a free database of medical literature, and learn how to navigate it effectively using various search strategies. Definitions. Medical databases, digital collections of medical information, including research articles, clinical trial reports, and review papers. Key terms, PubMed, keywords, filters. Example, searching for diabetes management on PubMed can yield hundreds of articles. Using filters like review or clinical trials can help narrow down relevant results. Slide 3, Interpreting Health News. Text, Critical analysis of health news. Bullet points. Evaluating the source, identifying reputable news outlets and journalists. Understanding the context, comparing news reports to original research. Spotting sensationalism, distinguishing fact from hype. Narration, health news shapes public perception, but not all of it is reliable. Learning to evaluate the source, understand the context, and spot sensationalism are key skills in interpreting health news accurately. Definitions. Sensationalism, the use of exciting or shocking stories or language at the expense of accuracy, in order to provoke public interest or excitement. Key terms: source, context, hype. Example: a headline claims, new study finds chocolate cures cancer. A critical reader would seek the original study, finding the claim greatly exaggerated. Slide 4, Understanding study types. Text: different types of studies in medical research. Bullet points. Observational studies, understanding natural health outcomes. Clinical trials, testing the efficacy of treatments. The importance of study design in research conclusions. Narration: medical research can be conducted in several ways, each with its own strengths and weaknesses. Today, we'll differentiate between observational studies and clinical trials, understanding how their design influences their conclusions. Definitions. Observational study, research that observes outcomes without manipulating study factors. Clinical trial, a study that experimentally tests the efficacy of treatments under controlled conditions. Key terms: efficacy, design, conclusions. Example: an observational study might find that people who exercise regularly have lower rates of heart disease, while a clinical trial could test if a specific exercise program reduces heart disease risk. Slide 5, Navigating PubMed effectively. Text: advanced techniques for using PubMed. Bullet points. Building a comprehensive search strategy. Utilizing mesh terms for precision searching. Saving searches and setting up alerts for new publications. Narration: to master PubMed, one must go beyond basic searches. Today, we'll explore advanced techniques, including the use of mesh, medical subject headings, for precise searches and how to stay updated with the latest research. Definitions. Mesh terms, a comprehensive controlled vocabulary used in PubMed to index articles for precise searching. Key terms: search strategy, precision searching, alerts. Example: searching with mesh terms like hypertension/therapy can help filter results specifically to therapeutic research on hypertension. Slide 6, Evaluating health blogs and websites. Text: assessing the credibility of online health information. Bullet points. Criteria for evaluating website credibility. Identifying red flags in health blogs and websites. Recommended trustworthy online health resources. Narration. In the digital age, health information is ubiquitous, but not all of it is reliable. We'll learn how to assess the credibility of online health resources, spot red flags, and identify websites that provide accurate and trustworthy information. Definitions. Website credibility, the perceived reliability and trustworthiness of a website based on various factors, including authorship, evidence, and transparency. Key terms: red flags, trustworthy resources. Example: a health blog promoting a miracle cure without citing scientific evidence raises a red flag. In contrast, websites like the Mayo Clinic or CDC, Centers for Disease Control and Prevention, offer information backed by research. Slide 7, The role of social media in health information. Text: navigating health information on social media. Bullet points. The influence of social media on health perceptions and decisions. Evaluating the credibility of health information shared on social platforms. Strategies for finding and verifying health information on social media. Narration: social media significantly influences public health perceptions and decisions. It's crucial to develop skills for evaluating the credibility of health-related content on these platforms and verify information through reputable sources. Definitions. Social media credibility, the reliability of information shared on social media platforms, often gauged by the credibility of the source and the evidence supporting the claims. Key terms: social platforms, verification. Example: a viral post claims a new superfood prevents cancer. Before sharing or acting on such claims, verify the information with reputable sources like academic journals or health organizations. Slide 8, Understanding health reports and statistics. Text: Deciphering health reports and statistics. Bullet points. Basic statistical concepts relevant to health information. Reading and interpreting health reports accurately. Critical evaluation of statistical claims in health news and literature. Narration: Statistics are the backbone of health reports, but they can be misleading if not properly understood. We'll cover basic statistical concepts and how to critically evaluate the use of statistics in health news and literature. Definitions. Statistical literacy: the ability to understand and critically evaluate statistical information and claims in various contexts, including health. Key terms: statistical concepts, interpretation, critical evaluation. Example: a report claims a 50% reduction in heart attack risk with a new drug, but a critical reader would examine the absolute risk reduction and study context to fully understand the significance. Slide 9, Case studies, applying skills in real-world scenarios. Text: Applying navigational skills, case studies. Bullet points. Case study 1, evaluating a viral health claim. Case study 2, using PubMed to research a medical condition. Case study 3, assessing the credibility of a health news report. Narration: let's put our skills to the test with real-world scenarios. These case studies will challenge you to evaluate a viral health claim, conduct research on a medical condition using PubMed, and assess the credibility of a health news report. Definitions. Case study: an in-depth investigation of a particular real-world scenario or example, used as a training exercise to apply theoretical knowledge in a practical context. Key terms: viral health claim, research, credibility assessment. Example: for case study 1, we examine a popular claim that drinking celery juice cures chronic illnesses, applying our criteria for evaluating source credibility and evidence. Slide 10, Building your health information toolkit. Text: equipping yourself with a health information toolkit. Bullet points. Key resources and tools for effective health information navigation. Developing a routine for staying informed with accurate health news. Creating a personal strategy for lifelong learning in health literacy. Narration: to navigate health information effectively, it's essential to equip yourself with the right tools and resources. We'll conclude this module by building a toolkit for staying informed and committed to lifelong learning in health literacy. Definitions. Health Information Toolkit: a set of resources, strategies, and practices for efficiently finding, evaluating, and using health information to make informed decisions. Key terms: lifelong learning, accurate health news, effective navigation. Example: your toolkit might include bookmarked medical databases like PubMed, reputable health news websites, and a list of critical questions to assess new health information. Module 4, Critical Analysis of Medical Literature, is designed to provide students with the analytical tools needed to scrutinize medical research papers effectively. This module focuses on understanding research methodology, the basics of statistical analysis, and the interpretation of results, critical for assessing the validity and applicability of research findings. Module 4, Critical Analysis of Medical Literature. Slide 1, Introduction to Critical Analysis of Medical Literature. Text: the art and science of analyzing medical literature. Narration: welcome to Module 4, where we delve into the critical analysis of medical literature. Our journey will equip you with the essential skills to dissect research papers, focusing on their methodology, the statistical analyses used, and how to interpret their results. Key terms. Critical analysis: the systematic examination of the merits and faults of a research article. Medical literature: scholarly articles and papers that discuss the findings of medical research. Methodology, the strategy, plan of action, process, or design lying behind the choice and use of particular methods in a research study. Statistical analysis, the science of collecting, exploring, and presenting large amounts of data to discover underlying patterns and trends. Results interpretation, the process of making sense of the data collected in a study, including understanding its implications and limitations. Slide 2, Understanding research methodology. Text, Decoding research methodology. Bullet points. Differentiating between qualitative and quantitative research. Evaluating the research design, experimental versus observational studies. Assessing sample size and selection methods. Narration, the backbone of any research paper is its methodology. Understanding whether a study is qualitative or quantitative, experimental or observational, and how participants are selected are critical first steps in analysis. Key terms. Qualitative research, research that seeks to understand a phenomenon by focusing on the qualitative aspects, often exploratory and open-ended. Quantitative research, research that collects and analyzes numerical data to identify patterns, averages, predictions, and possibly cause and effect. Experimental studies, research that manipulates one variable to determine if changes in one variable cause changes in another variable. Observational studies, studies where researchers observe the effect of a risk factor, diagnostic test, treatment, or other intervention without trying to change who is or isn't exposed to it. Sample size and selection, the process of determining how many participants are needed for a study and how they are chosen to ensure the results are statistically significant and representative. Slide 3, Basics of statistical analysis. Text, Navigating the numbers, statistical analysis in research. Bullet points. Understanding common statistical measures, mean, median, mode. Interpreting p-values and confidence intervals. Recognizing the importance of statistical significance versus clinical significance. Narration, statistical analysis allows researchers to draw conclusions from data. Grasping basic statistical concepts, such as mean, median, and mode, along with understanding the significance of p-values and confidence intervals, is essential for evaluating the results of a study. Key terms. Mean, the average value of a set of numbers. Median, the middle value in a list of numbers. Mode, the value that appears most frequently in a data set. P-value, a measure that helps determine the significance of the results from a statistical hypothesis test. Confidence interval, a range of values, derived from the sample data, that is likely to contain the value of an unknown population parameter. Slide 4, Evaluating study designs. Text, Assessing the foundation, study design. Bullet points. Comparing cross-sectional, cohort, and case control studies. The role of randomized controlled trials, RCTs, in medical research. Understanding meta-analyses and systematic reviews. Narration, the design of a study is paramount in determining the validity of its findings. From cross-sectional to cohort, case control studies, RCTs, and the comprehensive approach of meta-analyses and systematic reviews, each design has its strengths and limitations. Key terms. Cross-sectional studies, studies that observe a defined population at a single point in time or time interval. Cohort studies, studies that follow a group of people over time to see how certain exposures affect outcomes. Case control studies, studies that compare individuals with a specific condition, cases, to those without, controls, to identify possible causes. Randomized controlled trials, RCTs, studies that randomly assign participants to an experimental group or a control group. To rigorously test the efficacy or effectiveness of an intervention or treatment. Meta-analyses and systematic reviews, research that combines the results of multiple studies to arrive at conclusions about a body of research on a particular topic, often to assess the effectiveness of interventions or treatments. Narration: each study design serves a specific purpose in research, offering different levels of evidence. Recognizing their role and limitations is crucial for a critical analysis of medical literature. Slide 5. Critical appraisal of research findings. Text: dissecting research findings, a critical approach. Bullet points. Questioning the validity of the results. Analyzing the author's interpretation of the data. Considering alternative explanations for the findings. Narration: not all research findings are immediately applicable or accurate. Critically appraising the validity of the results, how the authors interpret their data, and considering other possible explanations are essential steps in the analysis. Key terms. Validity: the degree to which a result, of a measurement or study, is likely to be true and free of bias. Internal validity, or can be generalized to other situations. External validity. Data interpretation: the process of making sense of and drawing conclusions from data. Alternative explanations: other possible reasons for the observed findings, which may not have been considered by the researchers. Bias: systematic error or deviation from the truth in results or inferences. Generalizability: the extent to which findings from a study can be applied to the larger population or other contexts. Slide 6. The importance of sample size and power. Text: the role of sample size and statistical power in research. Bullet points. Understanding the concept of sample size and its impact on study results. Exploring statistical power and its significance in detecting true effects. Assessing the adequacy of sample size in research studies. Narration: the size of a study's sample and its statistical power are fundamental in ensuring the reliability of its findings. A study must have an adequate sample size and sufficient statistical power to detect true effects reliably. Key terms. Sample size: the number of participants or observations included in a study. Statistical power: the probability that a study will detect an effect when there is an effect to be detected. Effect size: a quantitative measure of the magnitude of the experimental effect. Type I error: the incorrect rejection of a true null hypothesis, a false positive. Type II error: the failure to reject a false null hypothesis, a false negative. Slide 7. Understanding biases in research. Text: identifying and understanding biases in medical research. Bullet points. Different types of biases and their impact on research findings. Strategies for minimizing bias in research design and analysis. Evaluating the presence and effect of bias in published studies. Narration: bias can significantly affect the validity of research findings. Identifying potential biases, understanding their effects, and evaluating how well a study has addressed these biases are crucial skills in critical analysis. Key terms. Selection bias: a type of bias caused by selecting non-random data for analysis. Information bias: a bias that occurs when there is a systematic difference in the way data on exposure or outcome are obtained from the study groups. Confounding: a situation in which a measure of the effect of an exposure on an outcome is distorted because of the association of the exposure with other factors that influence the occurrence of the outcome. Publication bias: the tendency for journals to publish positive research findings more frequently than negative or inconclusive results. Observer bias: a form of detection bias that occurs when researchers' expectations influence their interpretation of the outcomes. Slide 8. The role of peer review in research integrity. Text: peer review, ensuring the integrity of research. Bullet points. The process and importance of peer review in medical research. Challenges and limitations of the peer review process. Critical evaluation of peer-reviewed research. Narration: peer review is a critical checkpoint for research integrity, ensuring that studies meet the field's standards before publication. Understanding its process, recognizing its limitations, and critically evaluating peer-reviewed research are key. Key terms. Peer review, the evaluation of work by one or more people of similar competence to the producers of the work, peers. Research integrity, the adherence to ethical principles and professional standards essential for the responsible conduct of research. Blind review. A type of peer review where the reviewers' identities are concealed from the authors, to reduce bias. Open review, a peer review process where both the reviewers and authors are aware of each other's identity. Retraction, the withdrawal of a published study from the scientific literature, often due to the discovery of serious errors or misconduct. Narration, while peer review is foundational in maintaining research integrity, it's not without its challenges, including potential biases and the possibility of errors slipping through. Understanding these aspects helps in critically evaluating literature. Slide 9, Interpreting results and drawing conclusions. Text, from data to decisions, interpreting study results. Bullet points. Understanding the difference between correlation and causation. Evaluating the strength and relevance of study results. The role of limitations and future research directions in study conclusions. Narration, interpreting study results requires careful consideration of the data presented, discerning correlation from causation, and understanding the study's limitations. This critical step informs sound scientific conclusions and future research directions. Key terms. Correlation, a statistical measure that indicates the extent to which two or more variables fluctuate together. Causation, the action of causing something, established when one event is shown to cause another. Relevance, the degree to which something is related or useful to what is happening or being talked about. Limitations, the constraints of the study that may affect the results or the ability to generalize the findings. Future research directions, suggestions for further studies to explore unresolved questions or new avenues revealed by the current research. Narration, discerning the nuanced interpretation of results, especially distinguishing between correlation and causation, is essential for drawing valid conclusions and setting the stage for future investigations. Slide 10, Developing a critical eye for medical research. Text, cultivating critical thinking in medical research analysis. Bullet points. Practical tips for developing a critical approach to reading medical literature. Applying a systematic checklist for evaluating research articles. Encouraging skepticism and inquiry as tools for lifelong learning. Narration, developing a critical eye for medical research is not an innate skill but one that can be cultivated with practice. By applying systematic evaluation methods and maintaining a healthy level of skepticism, we can discern the quality and applicability of research findings. Key terms. Critical thinking, the objective analysis and evaluation of an issue in order to form a judgment. Systematic checklist, a structured tool used to methodically assess the quality and reliability of research. Skepticism, an approach that questions the validity of particular claims by calling for evidence to prove or disprove them. Inquiry, the act of asking for information as part of an investigation or study to explore questions and develop deeper understanding. Lifelong learning, the ongoing, voluntary, and self-motivated pursuit of knowledge for either personal or professional reasons. Narration, by embracing these principles, you're not just learning to analyze medical literature effectively, you're also preparing to engage with new research throughout your career, ensuring that your practice or research stays current and evidence-based. Module 5, Advanced Topics in Medical Literature, aims to deepen students' understanding of sophisticated elements in medical research, focusing on complex statistical methods and the processes involved in conducting and interpreting meta-analyses and systematic reviews. This module will provide the knowledge required to navigate advanced medical literature critically. Module 5, Advanced Topics in Medical Literature. Slide 1, Introduction to Advanced Medical Literature. Text, exploring the depths of medical research. Narration, welcome to Module 5, where we venture into the advanced territories of medical literature. We'll unravel complex statistical methods and the intricacies of meta-analyses and systematic reviews, essential for understanding high-level medical research. Key terms: advanced medical literature, scholarly works that incorporate sophisticated statistical analyses and comprehensive reviews of existing research to contribute new insights into medical science. Statistical methods, techniques used to analyze and interpret data to uncover patterns, relationships, and outcomes. Meta-analysis, a statistical analysis that combines the results of multiple scientific studies. Systematic review, a research method that collects and critically analyzes multiple research studies or papers on a predefined topic. Interpretation, the act of explaining the meaning of data or findings within research. Slide 2, complex statistical methods in research. Text, unpacking complex statistical methods. Bullet points. Understanding multivariate analysis and its applications. Exploring logistic regression in medical research. The role of survival analysis in clinical studies. Narration, complex statistical methods, such as multivariate analysis, logistic regression, and survival analysis, play a pivotal role in interpreting the multifaceted nature of medical data. These techniques allow researchers to explore deeper relationships and outcomes. Key terms: multivariate analysis, a set of statistical techniques used to analyze data that involves multiple variables simultaneously. Logistic regression, a statistical method for analyzing a dataset in which there are one or more independent variables that determine an outcome. Survival analysis, a branch of statistics that deals with the analysis of time-to-event data. Clinical studies, research conducted with human subjects, or on material of human origin, to evaluate the safety and efficacy of medical treatments or interventions. Data interpretation, the process of making sense of numerical data that has been collected, analyzed, and presented. Slide 3, conducting meta-analyses. Text, the process of conducting meta-analyses. Bullet points. Identifying relevant studies and data for inclusion. Applying statistical techniques to combine study results. Assessing heterogeneity and publication bias. Narration, meta-analyses require a meticulous process of identifying relevant studies, applying statistical methods to synthesize their results, and evaluating the consistency of findings and potential biases. This rigorous approach provides a high level of evidence. Key terms: study inclusion, the criteria that determine which studies are selected for analysis. Statistical synthesis, the process of combining data from multiple studies to arrive at a comprehensive conclusion. Heterogeneity, variation in study outcomes between different studies. Publication bias, the tendency for journals to publish studies with positive results more often than studies with negative or inconclusive results. Evidence level, the quality or strength of evidence provided by a research study or report, often classified in a hierarchy. Slide 4, understanding systematic reviews. Text, mastering systematic reviews. Bullet points. Defining the research question and developing protocols. Systematic search and selection of studies. Critical appraisal of included studies. Narration, systematic reviews start with a clear research question, followed by a structured search for relevant studies, and a critical appraisal of those studies. This method ensures that the review's findings are reliable and comprehensive. Key terms: research question, a clear, focused question that the research aims to answer. Review protocol, a plan that specifies the methodology of the systematic review, including search strategies and inclusion/exclusion criteria. Study selection, the process of deciding which studies meet the criteria for inclusion in a review. Critical appraisal, the assessment of the quality and relevance of research studies to address bias, validity, and applicability. Reliability, the degree to which the findings of a study or review can be depended on to be accurate. Slide 5, advanced statistical concepts. Text, diving into advanced statistical concepts. Bullet points. Exploring the use of Bayesian statistics in medical research. Understanding mixed models and their applications. Bullet points, continued. The significance of effect sizes and power analysis in interpreting results. Applying predictive modeling to patient outcomes and treatment efficacy. Narration. As we delve deeper into medical research, advanced statistical concepts like Bayesian statistics, mixed models, effect sizes, and predictive modeling become indispensable tools. These concepts help us predict outcomes, assess treatment efficacy, and understand the magnitude of effects in research. Key terms. Bayesian statistics, a statistical method that applies probability to statistical problems, incorporating prior knowledge alongside current evidence. Mixed models, statistical models that contain both fixed effects, parameters associated with an entire population or with certain repeatable levels of experimental factors, and random effects, associated with individual experimental units. Effect size, a quantitative measure of the strength of a phenomenon or the magnitude of the difference between groups in a study. Power analysis, a method to determine the sample size required to detect an effect of a given size with a certain degree of confidence. Predictive modeling, the process of using statistical techniques to predict outcomes based on data. Slide 6, Meta-analysis challenges and solutions. Text, navigating challenges in meta-analysis. Bullet points. Dealing with data scarcity and variable study quality. Methods for addressing heterogeneity among study findings. Overcoming publication bias and its impact on conclusions. Narration, conducting a meta-analysis comes with its set of challenges, including data scarcity and the variable quality of studies. Addressing heterogeneity and publication bias are crucial to ensure the validity of the meta-analysis conclusions. Key terms. Data scarcity, the lack of sufficient data for analysis, often due to the rarity of the condition or the novelty of the treatment being studied. Study quality, the assessment of how well a study was designed and conducted, impacting the reliability of its results. Heterogeneity, the variation in results across studies, which can arise from differences in study populations, interventions, and outcomes measured. Publication bias, the tendency to publish studies with positive findings more frequently than those with negative or inconclusive results, potentially skewing the evidence base. Validity, the accuracy and truthfulness of the conclusions drawn from research data. Slide 7, Systematic reviews in practice. Text, implementing systematic reviews, from theory to practice. Bullet points. The role of systematic reviews in evidence-based medicine. Steps for conducting a rigorous systematic review. Utilizing systematic reviews for clinical guideline development. Narration, systematic reviews are a cornerstone of evidence-based medicine, providing a comprehensive synthesis of the evidence on a given topic. Conducting a rigorous systematic review involves meticulous planning, execution, and application in developing clinical guidelines. Key terms. Evidence-based medicine, EBM, an approach to medical practice intended to optimize decision-making by emphasizing the use of evidence from well-designed and well-conducted research. Clinical guidelines, recommendations on the appropriate treatment and care of people with specific diseases and conditions within the healthcare system. Comprehensive synthesis, the process of combining data from multiple sources to create a complete overview of the current evidence on a topic. Meticulous planning, the detailed and careful design of a research study or systematic review protocol. Execution, the process of carrying out the planned steps of a systematic review or research study. Slide 8, Interpreting results in meta-analyses and systematic reviews. Text, decoding the results, meta-analyses and systematic reviews. Bullet points. Understanding the implications of pooled data analysis. Assessing the strength and applicability of evidence. Challenges in translating review findings into practice. Narration, interpreting the results of meta-analyses and systematic reviews requires an understanding of pooled data analysis, assessing the evidence's strength, and recognizing the challenges in applying these findings to clinical practice or policy development. Key terms: pooled data analysis, the combination of data from several studies into a single analysis to increase statistical power. Evidence strength, the reliability of the evidence, often determined by the study design, quality and consistency of findings. Applicability, the relevance and usefulness of research findings in real-world settings or specific populations. Translating findings, the process of applying research conclusions to clinical practice or policy making. Clinical practice, the day-to-day practice of medicine by health professionals, particularly those who are physicians. Slide 9, Advanced topics in statistical analysis. Text, beyond the basics, delving into advanced statistical analysis. Bullet points. Exploring nonparametric statistics and their use in medical research. The importance of covariance analysis in observational studies. Utilizing structural equation modeling in complex data analysis. Machine learning applications in analyzing large health datasets. Narration. Advanced statistical analysis offers powerful tools for understanding complex relationships in medical research. From nonparametric statistics to machine learning, these methods allow researchers to analyze data with precision and uncover insights that inform patient care and health policy. Key terms: nonparametric statistics, statistical methods that do not assume a specific distribution pattern of the underlying data, useful in analyzing data that do not fit normal distribution parameters. Covariance analysis, ANCOVA, a statistical method that removes the effects of one or more covariate variables that might affect the dependent variable but are not of primary interest. Structural equation modeling, SEM, a multivariate statistical analysis technique used to analyze structural relationships between measured variables and latent constructs. Machine learning, the use of algorithms and statistical models by computers to perform specific tasks without using explicit instructions, relying on patterns and inference instead. Large health datasets, collections of health-related data that are too large or complex to be dealt with by traditional data processing application software. Slide 10, The future of medical literature analysis. Text, looking ahead, the evolution of medical literature analysis. Bullet points. Emerging trends in medical research methodologies. The role of artificial intelligence in synthesizing medical literature. Challenges and opportunities in the digital era of medical research. Narration. As we look to the future, the field of medical literature analysis continues to evolve, with emerging trends and technologies reshaping how we conduct and interpret research. Artificial intelligence and digital platforms offer new opportunities and challenges, pushing the boundaries of what's possible in medical literature analysis. Key terms. Emerging trends, new developments that are becoming popular or gaining importance in the field of medical research. Artificial intelligence, AI, the simulation of human intelligence in machines that are programmed to think like humans and mimic their actions, applicable in analyzing complex data sets. Digital era, the current age, characterized by the widespread use of digital technology and the Internet, affecting all aspects of society, including medical research. Methodology evolution, the process by which the methods used in medical research are developing and improving over time. Research interpretation, the act of making sense of research findings, including assessing their validity, applicability, and implications for future research or clinical practice.